In Nigeria, cervical cancer is the second most common cancer. An estimated 10,000 new cases of cervical cancer are recorded every year, and 8,000 deaths due to the disease are recorded among women yearly. The situation we have just talked about here is frightening, but if nothing is done, it could become worse, and that is exactly why we'll be talking about this today on this particular episode of Health Matters, your TV health program. We will be talking about cervical cancer. What is this? What are the causes and what can we do? Yomi Ogunye is my name. Once again, you are welcome to the program. My guest today is a gynecologist, a doctor you've seen before on this program. He is Dr. Joel Akande. And sir, you are welcome to the program.
Thank you very much.
Today, I just told your audience that we will be talking about cervical cancer. Lead us into this discussion. What is cervical cancer?
Thank you very much. The first thing to understand is the anatomy, the structure. In other words, the structure. The cervix is the neck of the womb. There's the womb, and there is a neck. It's like an inverted balloon. When you inflate a balloon and invert it, the smaller the mouth becomes down and the balloon is up. The one that is up is the womb, which contains the baby. The balloon's mouth that you tie is the neck of the womb. That is how it looks. So that neck of the womb is called cervix, and it controls what goes into the womb and what comes out of the womb. For example, it contains it controls the semen that goes into the womb, and then it contains the blood flow that comes out of the womb and the baby that comes out of the womb. Any access to the womb is where it is controlled. So it is very important structure. Now, during sexual intercourse, the man's genital cannot go beyond that. And so I told you it controls. It cannot go beyond that, and that is where the semen is deposited. Therefore, majority, by the way, the cancer, the changes in that neck of the womb, whereby the cells that make up that cell, the neck of the womb, can no longer be contained there. They change and start multiplying in an uncontrollable manner. When that happens and it begins to affect other organs around it, it is called, and there is a DNA change, it is called cancer. And when it happens in that neck of the womb, it's called cervical cancer. That is by definition what cancer of the womb simply is. And there are two types. One occurs inside, one occurs outside.
Thank you very much. When it occurs around the cervix, you said, it is called
the cancer
cervical cancer. Mm-hmm. That's a very good one. No doubt this is a deadly disease.
Yes.
We just told you that 8,000 deaths due to this disease occur in Nigeria every year. May we know the causes? Why will this have to be?
Let me also quickly add to that data. About 37 million Nigerians are at risk. Never mind the 10,000 that you just mentioned. About 36.9 Nigerians are at risk of developing cervical cancer. What are the causes? If you have, there is no specific cause that has been found, but we have seen the trend that this thing happens in certain population, in certain manners. If you begin the risk factors, if you begin your sex life very early, before 17 or at 17 or thereabout, you are at risk of developing cervical cancer. If you have multiple sexual partners without using preventive barriers, condom, you are at risk of developing cervical cancer. If you have infection, what is called human papilloma virus, you are at risk of developing cancer. If you have gonorrhea, syphilis, HIV, you are at risk of giving rise, of giving room to HPV, which will also be associated with cervical cancer. There are some people that has family history of cervical cancer, and it kind of run in their family. That is not to say that because it runs in the family, you will have it. That is not to say that if you have HPV, you will have it. But these are risk factors. And also obesity, and there are some medications like family control, which may also give rise to the risk of developing cervical cancer.
In responding to that, you dwelt largely on the risk factors. Will your explanation be sufficient enough for the causes?
Now, like I mentioned to you, the scientific world, we have not been able to say this is the specific cause. We can associate. Now, if we could zoom in on the causes, the majority of cervical cancer has been found to be due to human papilloma virus. In other words, like I said before, it is not necessary that if you have human papilloma virus, you will have cervical cancer. But we have seen that in majority of cases, even up to 80 to 90%, we could isolate human papilloma virus from cervical cancer patients.
All right.
So, if you like, you can say by broad classification that human papilloma virus may cause cervical cancer.
All right. Thank you very much for clarifying that. Now let's talk about the symptoms. How would anyone, it is a woman's disease now, know that she has come down with cervical cancer? What symptoms should she be watching out for?
Okay, before I answer that question, I quickly want to make an adjustment to your statement. People who do not have sex, if you have never had sex, your risk of developing cervical cancer is extremely small. Meaning that you can literally say that cervical cancer is a sexually transmitted disease by virtue of human papilloma virus infection. Who gives the woman human papilloma virus? You can trace that to the man.
In other words, you are trying to absolve the man, so you don't want us to call it a woman's disease.
It's not a woman's disease.
Okay, I go with you.
The man is largely responsible
for it. What I actually meant by that is that since the woman now is the one that will present with all of this,
yes,
that's what I actually meant by saying a woman's disease. But your explanation is equally
thank you very much.
Noted.
So as to the symptoms, symptomatology, as we say, is it might even go on for months, even years, without even having any symptom. But that can be dictated by preventive measures, which we might talk about later. Now, pain during sex might indicate that there is a problem. A woman from Sokoto sent me a message this morning that I'm 57-year-old woman that I'm discharging. At 57, that should not happen. So the first thing that crossed my mind is that this woman probably has some cervical cancer. So vaginal discharge, it may be offensive, it may be bloody. And if that happens at any time, then you need to get screened. The other one is bleeding, irregular bleeding, bleeding during sex, bleeding between periods. Those are signs and symptoms. Pain, pelvic pain, in other words, pain in your private areas, or even swelling, might be an indication that, of course, like I said, painful sex is another important symptom.
Thank you very much. How prevalent is this? How well do our people know about this, and how rampant is it in our society?
250 people out of 100,000 Nigerians are at risk.
250 people?
Yes, out of 100,000.
100,000?
Yes, it's that prevalent. It's at risk of
cervical cancer.
It's very common.
That's so sad. Thank you very much for that.
Yes,
now, when a woman, senses all of this, you have told us some of the symptoms and risk factors. When she comes to your hospital, what exactly would you be doing or telling her?
Well, counseling matters. Of course, the way we handle patients is very important. Of course, she needs the empathy, the sympathy, whatever support you can give. But she needs to be aware of what has developed in her and how it will ultimately be managed. It may not necessarily be us that will manage it, but at the primary care, at the primary level, that will have to be taken care of. And then, subsequently, she will need to go to what is called oncologists, the people that deals with the cancer as a specialty. So they will take care of that. The stage, we call it stages. There are about 4 stages, and then there is a stage, a level which is not even staged. In other words, there are pre-cancer. That this is pre-cancer. But once the cancer has been diagnosed, there are 4 stages. So, and the 4 stages, more or less, you can quickly contain that. When it's getting to the 3rd and 4th stage, action is extremely urgent. Action is necessary.
You talked about 4 stages. Are there types of cervical cancer?
There are types. There are adenocarcinoma, there is squamous cell carcinoma. We should not bother about that in details. Yes. So there's adenocarcinoma, which the oncologist will deal with. It's just for us to be able to manage what type of cancer is and to direct the kind of medication that needs to be given, the kind of treatment. So, but it's regardless, cancer of cervix is cancer of cervix, and that has to be dealt with as a matter of utmost urgency.
Cancer has to be dealt with as a matter of utmost urgency. That's what you have just said. And viewer, thank you very much for watching us. You are listening to Dr. Joel Akande, a gynecologist who has been telling us about cervical cancer. He will tell us a lot more when we come back. Don't go away. Welcome back. You are still watching Health Matters, your TV health program. My guest, Dr. Joel Akande, is still very much on set. And once again, Doc, you are welcome.
Thank you, sir.
We are talking about cervical cancer. Now, let's talk about the diagnosis for this. As a medic, you talked about someone in Sokoto, who sent you a text message. Assuming she presented before you now, what exactly would you do?
Of course, depending on her presentation, she will be examined. We will take the history, what are your symptoms, and then of course she will be examined. All her body will be examined, because this thing can spread so quickly and so easily, and you might not know that what is so hidden deep down in the body is the one that is affecting the chest and the brain. So we examine her, and of course we take samples, and we might take sample from we take a look at the neck of the womb, and then we take a little bit of a swab or a sample and send it to the lab. And then in some situations, with experience, you can see this is cancer. You don't need anybody to tell you. It's obvious, it's clear. From that point, you just take the next step of referring to the oncologist. So it is important that private people may not necessarily have the capability to treat cancers. It's usually tertiary institutions where there are multi-specialists that will handle cervical cancer treatment. So, in summary, history of the patient, the examination, the sampling, and of course, if it is obvious, you send immediately to other specialists.
So what's the treatment like?
Well, it depends on the stage and the permission, or what we call consent, of the client, and it might even be as simple as taking a cup, some big chunk of the neck of the womb, and so that you take all the areas of the cancer away, surgery, or the entire womb might have to be removed with clearance of anywhere it has spread to. We're talking of life here, and you're just you might think, I don't want to remove my womb. Then you might lose your life if you don't want to remove your womb. It might not necessarily mean you remove your womb, especially if you have not had your own child. So in that case, surgery. It might also require radiotherapy. In other words, X-rays are beamed into that area. It might also mean that drugs will be used, or all of these, surgery, chemotherapy, and radiotherapy might all be that is required to preserve the life of the woman.
You talked about her giving birth to a child. How have you resolved that?
You see, this is the very complex issue that presents us with dilemma. This woman needs a child, wants a child. Here she is, 27-year-old, 35-year-old, her cancer of the cervix. So the first thing might be to preserve her eggs or her embryo, as the case may be. That would be a different thing through IVF. So, and we can freeze that, and later on when she's recovered, that treatment can come back. So, but the first time, the law says, and the practice is, the life of whom we are seeing, this woman, is the primary thing, is the most important, and we must save her.
Thank you very much. Now let's talk about how we can prevent cervical cancer. Is it preventable? What can we do?
Let me give you two countries that has determined to eradicate cervical cancer in the next 2 or 3 years.
That's a good one.
Decided and determined. One is Rwanda. It's not far-fetched. Africa, Rwanda, has determined that in the next few years they will eradicate cervical cancer. The second country, Australia, have decided that, in fact, they are about to declare either next year, probably next year, that they have eradicated cervical cancer. Why? Because it's preventable. One, vigilance is required. Every woman that has ever had sex, or you have reached age of 18 or 17, as the case may be, whichever comes first, you should be having a smear test once in every 3 years, with the test of human papilloma virus included. If you have human papilloma virus, you should be treated. And so pap smear, what we call cervical cancer screen, should be in every woman who has reached that adulthood, or who have had sexual encounter once in every 3 years, will save life. The second one, the most important one, also not necessarily the most, but also very, very important, relatively new. Girls from age of 11 should be vaccinated against human papilloma virus, and the recent research says that from 11 now to age of 46 or 45, women in that category can be vaccinated, including men. So boys can be vaccinated, men can be vaccinated if they don't already have human papilloma. So girls can equally be vaccinated against human papilloma.
That takes just away the factor of the human papilloma virus.
There are other factors. Yes, the other factors. The third one is the fact that our behavior as human beings, having multiple sexual partners, is a huge risk. You are carrying a massive amount of risk by exposing yourself to all sorts of sexually transmitted infections, which I mentioned earlier, which may also give room to human papilloma virus, gonorrhea, syphilis, HIV 1 and 2. So all of these could also potentially allow human papilloma virus to come in. So if you are unable to contain yourself, you better use the barrier method, which is called condom. But human factor called multiple sexual partners should be should be considered as a huge factor which you can prevent yourself. And of course, smoking. We might say smoking is not a big issue in our environment, but I've seen women smoke in this place. In Europe, for example, it's a very common thing. 10% of the population smoke, but here in Nigeria, it might not be that big. But if you are at risk, and obesity, exercise to reduce your risk of developing cervical cancer.
That's a good one. Now, as we come to a close on this program, I will want you to give us your counseling. What advice will you give to the public, especially the woman?
We don't have a national program like Rwanda and Australia or UK, America for screening cervical cancer. Take your own health into your own hand. Your own health as a woman into your own hand. It costs just a few thousand naira to screen for human papilloma virus and cervical cancer every 3 years. And it costs another few thousand naira to be vaccinated against human papilloma virus. So take care of your own health. Look after your life. Is your life, and you need to understand that that is the most valuable thing you ever have. And of course, watch it. Multiple sexual partners is predisposing you, or you are carrying a risk of cervical cancer.
Thank you very much, Dr. Joel Akande, for being with us here today.
Thank you, sir.
You dwelt elaborately on one issue. We all, especially the woman, must take very good care of herself. And viewer, thank you very much for watching us. For some time you have been here watching and listening to Dr. Joel Akande, my guest, a gynecologist who has been telling us quite a lot about cervical cancer. It is not a death sentence and it is preventable, but he wants you to take very good care of yourself and stay away from infections. And this is where we drop the anchor on today's episode of Health Matters, your TV health program. Yomi Ogunye is my name. Do find time to watch us again, same time next week. Goodbye.